Hello class, this is video block number 7. My name is Jason Arnold and this is for Healthcare Informatics course 645. Today we were just asked to discuss 3 important characteristics for good measures or metrics, and but to understand that you definitely want to understand measuring the actual change, and the most comprehensive way of doing that is doing a PCDA, which is your PDCA, excuse me, and that's going to be like your planning, your doing, your checking, and your acting. The P is for planning, of course, is making sure that you determine whatever goals are needed and the changes that are going to be needed to achieve those goals. As far as the doing, is actually implementing those changes, you know what I mean, and that's either internal or externally, which we'll discuss a little bit later. The check is, again, evaluating those results or the performance measures that were needed, and then lastly the act is actually you standardizing the implementation over the course of the organization. And if that does not work, then the actual process is going to need to be repeated until that can be done. So again, we discussed the standardization in the ACT portion of a PDCA, and that's going to be provided by the measures that you're going to need, and basically it's going to be used to, again, assess the performance. And so, like, if you have new guidelines that's going to be implemented, it's going to be used to provide a measurement or to assess, like, the safety of an organization, and that's going to make sure that improvements are going to be readily available. And and a lot of times I see healthcare organizations do this. A lot of times they're more reactive than proactive, but it's better to react to certain things and make sure they never happen again than to be not compliant with those things, and then they happen, and then you don't have a choice because the organization is closed down. We've seen a ton of healthcare organizations that have closed due to negligence and things of that nature. So you rather catch those smaller events, or catch an event and take a hit and be preventative for the next time than to not acknowledge it at all. An example the book gave was a very good example as far as patient falls and that data. Taking the total number of patient falls and dividing it by the number of days that the patient has been on a certain protocol. I know we do that a lot at my hospital. They do things of that nature as far as having administration and risk management professionals, or clinical staff, or even other clients as well. They're going to make sure that the things that you implement are going to make a difference as far as the comparative data. So if a person is on a fall protocol, things that you can do to make sure that, or metrics that you can put in place, could be like to make sure that the person, if he's on a 1-to-1, you know what I mean, that would be more of a balancing measure, which is going to be something that's going to be more robust, that's going to make sure that things are in place. But also making sure that, okay, if a person's on a 1-to-1, okay, you have to make sure that the person is not at risk when he's taking showers, or that he has appropriate shoes on, or if the person does have weak mobility, getting him physical therapy, or having a Mary walker, things of that nature. Those are going to be strategic measures put in place, so that when the data comes back, you can see that the measures that you implemented were effective. Another example that I could talk about as well would be choking risk, and I wanted to talk about that later in the video. Wow, it's already at 4 minutes, and that's going to be like I have here, like, it's the same as the fall risk, but again, the choking protocol would be if a person was giving a different diet or things of that nature as a means to prevent methods of choking. But again, I'll talk about that in a second. As far as that comparative data, sorry about that. As far as that comparative data is concerned, you want to make sure that you have metrics that are useful. They're going to support the strategic goals of the health organization or risk management professionals, and those are going to be produced by a government body, stakeholders, things of that nature. As far as the metrics that I thought were very good metrics, the first one was quantifiability. That's kind of an obvious one. That's just making sure that you have success, and what measures are being are being implemented, or what is the goal of the measure. So if I want to use an example of suicide precautions, okay, well, the quantifiable measure would be a reduction of suicide attempts, or increase in response to suicide ideations, or a reduction of individuals placed on one-to-one precautions, or things of that nature. That's going to be something quantifiable that you can determine the success. Another one that I thought was really, really important, and I can use that same example as far as suicide prevention, would be realm of control. And that's usually a thing or issue of internal versus external. We see that a lot. So in suicide precautions at a mental health hospital, we have, again, a lot of patients who maybe, I hate to use this example all the time, but maybe facing murder charges in prison. They get sent to our hospital, and they have to weigh the risk of either going to jail for life or being in a healthcare hospital the rest of their life, and they would choose the latter because it's a lot easier. And so they would say things as like, I'm thinking about killing myself, or they'll have, mock attempts just to make sure that they're there longer, because, in a jail it might not be as preventable. So something that would be, internal versus an external control would be, internal would be like making sure that individuals don't have extra blankets or use an extra pillow that they make and suffocate themselves. That may be an internal control. But an external control would be that, okay, well, no patients that's on an intake unit would be able to have a drawstring in their pants, or they cannot have shoes with shoestrings on them. They have to have straps, or they cannot, anytime they're placed on one-to-one protocols, and they have to be in a certain suicide garb, or they have to have tear-proof sheets, or they have to be an increase in room checks from every 30 minutes to every 15 minutes. Like, those are going to be those external measures that's going to make sure that consistency is placed over the entire facility. Well, I'm over my time. Okay. The next one would be reliability, and that's going to be making sure that, again, with the suicide example, will these measurements that are put in place, will they be effective with different users? So on different shifts, if different people are handling the same information, if I have a person that's on suicide precaution or suicide preventative, measures, would person A on 7 to 3 shift have the same results and the same standardized care as a person on 11 to 7? And that should be definitely a yes. You want to make sure that the changes are going to be consistent over those different shifts. So, and that's going to be a measure of, I think it's called interactor. I thought I wrote it down. Interactor reliability. Sorry, I'm trying to use keywords. And that's going to just make sure that once you're measuring it, that those measurements are high, and making sure that there is consistency once again. The last thing I was going to say is, I can't believe it's 8 minutes. Would be baseline. And the baseline would be like the measurable, comparison to follow data. So if I use a different example, the previous example of choking, let's say we had a patient that was told, because you want in the baseline that the data that's collected for the patient, we will want that information you would want that information versus information that happened after an intervention. So, oh Lord, hold on. Sorry, I had a call. So, sorry, I had a call. Okay, so it would be, let's say, if you have a patient that came in on a safety, with issues or with choking, first you would probably tell the patient, okay, well, let me just educate him on slowing down, chewing his food, being there to coach him, things of that nature. You would need that information versus more information of having a speech pathologist come in, or having a swallow test done to make sure that the person's actually getting food down appropriately, or changing the diet. Nursing may change his diet from a regular, or the dietitian may change his diet from a regular diet with solid foods to an NDD3 diet that has soft, mashed, or pureed foods, and then you measure his incidence of choking from there once he's been placed on a choking protocol. So those types of metrics and measurements are definitely great for a healthcare organization, and again, it provides consistency and makes sure that success is definitely achieved. Wow, I doubled up my time. I do apologize. Just definitely trying to get the information out in a relatively thorough fashion. But I thank you all for your time. It's been a fun semester. We've made it. So any questions, comments, concerns, I look forward to hearing them. Thank you so much.